Thank you, Dr. Ankita and Sahani sir. Good evening, good afternoon, and good morning. This is the 1420th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session, and today our guest is Dr. Shalini. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy was formed at the time of COVID by a group of homeopathy lovers and homeopathic students and doctors. And we have doctors and eminent personalities from 65 countries are present at different purposes in this forum. And we have 3 sessions every day. The 7 to 8, we have the Hindi session, 8 to 9, the international session in English, and 9 to 10, the local language session in Malayalam. Today, our guest is Dr. K.A. Shalini, BHMS, and she has graduation from Government Homeopathic Medical College, Bangalore from 2009. And she has completed the certificate course in children health, that is CGH, and certificate course in gynecology and obstetrics, that is CGO, certificate course in skin and venereal disease, SPD, from BIMT, Pune, Maharashtra. She is the duty doctor, Homeopathic Charitable Center, Bangalore, from 2009 and to 2015, and now Nisarga Clinic, Bangalore, Karnataka, from 2015 onwards. She has presented many papers in this forum, and all the papers were really relevant and has been very worthwhile for homeopathic fraternity. Today, Dr. Shalini will be talking about rabies and its homeopathic treatment. This is one of the area where we have some very important matters to be discussed, very important and relevant factors, because there are a lot of dogs having this rabies, and from there, most of human people who are affected with the bite of this rabies dog. So how we can manage all those things, and what are the precautions we need to take, and how we can differentiate this from other diseases. So all these things need to be discussed, and we can proudly welcome the guest of the day, Dr. K.A. Shalini. Welcome, doctor.
So thank you so much. So thank you so much for giving me an opportunity. So today I'm going to discuss about rabies and its homeopathic management or the treatment part. So now I'll be sharing the slides. Yeah. Okay. Rabies and its homeopathic treatment. So this is the topic I'm going to discuss. So in our day-to-day clinical practice, we daily see many dog bite cases. So dog bite cases, like in our practice, in day-to-day practice for small children or adults or old age people, these dog bite cases are more we see. So when the dog has this rabies disease, it is transmitted to humans by the dog bite. So rabies is a very dangerous disease, and it causes death in both animals, dogs, and humans also. So first we'll know the definition of rabies. So what is rabies? So rabies is a viral disease that causes acute encephalitis, that is the inflammation of the brain in warm blood animals. So it is a viral disease. It causes death in both humans as well as animals. So dog bites or any other bites like cats or any animal bite is very dangerous. So any bite, after the bite they have to go to a doctor and take vaccination and the treatment for them. So rabies, it is a zoonotic disease. Zoonotic disease means the diseases which is transmitted to humans from animals. that is caused by a virus. So rabies is one of the major and important zoonotic disease. And July 6th, every year, we celebrate World Zoonotic Day, World Zoonotic Diseases Day. Like we give, or the WHO has given guidelines like July 6th is World Zoonotic Disease. So rabies is one of the major and important zoonotic disease. Rabies and other diseases like Kefenor forest diseases, anthrax, um, avian influenza. These are all zoonotic disease, but rabies is a major and it is a very important disease. We see in urban areas also and also in rural areas also. Many patients with dog bites, like not knowing the like not knowing the complications or unawareness, many patients with dog bites, they will not go to doctor for treatment or the vaccination, and they suffer from rabies. And within 1 month or 1.5 months, there are many cases of rabies death in humans. So now we'll see how the rabies virus reaches the human brain. In rabies, we see a major symptom is, or the condition is, encephalitis of the brain, means inflammation of the brain. Sorry, inflammation of the brain is seen. So, see in this picture, you can see the first one, the below one, virus enters tissues from saliva of biting animal. So, any animal, for example, dogs only are the major source of infection which transmits to humans. So virus enters tissues from saliva of biting animal. Then the virus replicates in muscles near the bite. So when there is a bite, like there are any scratch, so dog bite means there are we see the stages of bite or the injury caused by the dog. So if it is scratch, that is the grade 1. If it is little deeper, then grade 2. Like third degree bite means when there is a deep wound on the cheeks or on the back or on the hands, deep, means that is the third category of bite. So virus replicates in muscles near bite. So this virus replicates and it enters into the body. And the third is virus moves up through the peripheral nervous system to CNS in the spinal cord. See, you can see in the picture. And the fourth one is virus ascends the spinal cord. See, in the picture, you can see the yellowish marking. Virus ascends into the spinal cord. And in the fifth option, virus reaches brain and causes fatal encephalitis. So this yellow marking, you can see the ascending part of the virus to the human brain. And the sixth point is virus enters salivary glands and other organs of the victim. So in the government sector, in the primary health centers, they give a vaccination called ARV, that is anti-rabies vaccination. That is after the bite, means it is called post prophylactic vaccination. So there is a dates called 03621. So based on their dates, they have to go and take the vaccination. In an older generation, these dog bite injections were given on the abdomen. On the abdomen, they used to give, but now they give vaccination to the arms. TT injection is also given, and this ARV injection, which is called Rabipure vaccination, is given. So this is how the rabies virus ascends to the brain and causes encephalitis. So in this picture, you can see the source of rabies, that is bats and dogs dogs, maybe street dogs also, and pet dogs also, pet cats also. You can see in the source. And the symptoms of rabies, this is very important. If any person doesn't go to any vaccination or any homeopathic treatment or any treatment, if he doesn't go, then the stage 1 symptoms, like the patient suffers from headache. First point is headache. Then there is a rise of temperature, loss of appetite is seen, and there is vomiting, diarrhea, and running nose. These are the stage 1 symptoms. Stage 2 symptoms, the patient becomes very aggressive, and there is photosensitivity, and there is cramps, and there is redness of the eyes, and hydrophobia. That is the in the stage 2 symptoms, there is aggression. Photosensitivity means he doesn't like light, he doesn't like the light, and cramps is seen. And in stage 3, that is the last, there is there is dryness of the eyes, or the paralysis of the eye muscles is seen, and there is a salivation from the mouth, and hydrophobia. And at the third stage, the patient death occurs. So rabies is very dangerous disease, because initially the patient, with his unawareness or carelessness, after the dog bite or any animal bite, if he doesn't go to any treatment, then these are the parts, and these are the symptoms, and at the last it causes death in 1 month. Because I have seen the cases during my when I was studying, so I have seen this kind of cases. So so the patient has to go to treatment. Okay, so more than 50,000 people die from rabies each year in the whole world. So what are the first aid we can do? The first one is, when any dog bite or any animal bite happens, we should clean the wound, flush the wound with clean water, and go to a nearby hospital and take vaccination or the treatment. And 6 months, they have to stop taking alcohol, and 6 months means they have to stop, like these are the general we advise, like if they are smoking or drinking, they have to stop it. So first is we have to clean the wound, then go to a nearby hospital and take the vaccination. Next, we see the types of rabies virus. First one is the street virus. See, dog bite, like usually street dogs only bite. Recently, in last month, I have seen a case in one, I read it in the newspaper. Like a street dog, which is a mad dog, it has continuously bited 9 people, one after the other. So, so those people with they have to take vaccination or the treatment. The first one is street virus. Definition is the virus recovered from naturally occurring cases of rabies is called street virus. The sources is it is naturally occurring virus. It is found in saliva of the infected animals. Fixed viruses is the virus which has a short, fixed, and reproducible incubation period is called fixed virus. Sources is it is prepared by repeated culture in brain of rabbit, such that is IP is reduced and fixed. So these are the types of viruses. See here, you can see the another types of rabies. The first one is paralytic rabies. In 20% of cases, laggardly muscles become paralyzed, that mostly occur when an animal bites. Furious rabies means 80% cases of rabies are furious rabies. In this type, patient having classical symptoms of rabies, as I have previously told. So these are the two types of rabies. See, this is the picture where dogs are infected with rabies, and when any dog bite occurs, first aid has to be done, like cleaning the wound, go to a hospital or clinic and take vaccination. Vaccination is very important. Sources, animal bites, dogs, cats, or rabbits. So symptom is, as I have told, there will be muscle cramps, headache in the initial stages, and photosensitivity is seen. At the last stage, hydrophobia is seen. So here you can see clearly the early signs and symptoms, early and late signs and symptoms. First one is fever, cough, sore throat. Early signs and symptoms. Late is restlessness, hallucination, seizures, coma. uh, when I was studying, I have seen a case. The patient, aged 60 years around, female patient. She is a farmer, and she had bitten by a dog when she was doing farming. In her old age, also she was doing farming, and with reluctantness, she has not told to her home, like dog bite has happened, and she's not taken vaccination or the any treatment. And within 1 month, she started photophobia, hallucination, seizures, hydrophobia mainly. And when she was taken to hospital, like it was in the last late stage, and death occurred. Okay. The complications of rabies virus when it is infected is, first one is seizures, hallucination, psychosis, aphasia, autonomic instability, paralysis, coma, death. Late complications is cardiac failure, respiratory failure, multiple organ failure. So who are all the risk factors? Means low income developing countries contribute to infect the traveler by rabies like from other countries. Involvement of activities with wild animals also transmit rabies. Searching that areas where bats bite also causes rabies. Not taken any protective method to keep away wild animals from camp. Will not use the safety protocol in laboratory from rabies virus during working. In the brain, traveling of rabies virus due to head or neck injury or wounds. So how we can prevent this rabies is mass dog vaccination, that is ABC. That is mass dog vaccination is done at the veterinary level. And there is okay. A veterinary authority, animal sampling and testing is done. Leave wildlife alone. Rabies education, the major part is we have to educate the society in schools level or in villages. We have to give health education regarding the rabies. Like if any dog bite occurs, they have to go to a nearby hospital and take the treatment. So education is very important. Here I'm going to discuss a case on the in the homeopathic part, like how it is dealt. The patient came to a clinic. He was tried to be treated by various physicians and referred back and forth. Was dog bitten 2 months ago. The disease progressed as follows. The trouble was noted 2 weeks ago. In the beginning, the speech begins to slur. Many words he used to speak used to be unintelligible. Sorry. Okay. Irritability increased to a marked degree. So as I have told, rabies virus, it reaches the brain. So we see mainly of CNS complaints only, like hallucination, saliva, from the mouth is drooping, and irritability, aggressiveness, hydrophobia. These are the symptoms of rabies. So usually we see that kind of symptoms. In the beginning, the speech begins to slur. Many words he used to speak used to be unintelligible. Irritability increased to a marked degree. So the patient was very irritable. He became violent, angry, and dangerous. Mild fevers off and on was seen. Symptoms in this regard changeable. So when there was fever on and off, and he used to take the medications like usually when they get in any shop or medical shop. Symptoms in this regard changeable. Extreme thirst was seen. Ravenous hunger was seen. Hurried and impatient. So there was extreme thirst, but he was not able to drink due to hydrophobia, fear of water. Okay. Hurried and he was impatient. Desire to escape. Desire to bite and strike on others. Balance of the body became unstable. Salivation, copious visit. There was great stiffness in lower limbs, no pain. And there was he had craving for ice cold water, but unable to drink due to spasm in throat spreading throughout the body. Hence, extreme fear of water was seen. His temperament was irritable, desire to injure others, desire to clinch to his mother. Surprisingly, no anger or violence towards his mother. Gestures as if trying to frighten others or to injure them. Eyes staring, wild looking, and there was craving for light. Head was hot, limbs cold, shrieking, obstinate, striking himself too. History of mild head injury 3 years ago. No problem was felt ever before. After that, was a very timid baby when he was child, and he was very timid with caries teeth, having habit of sleeping on abdomen, and the clinical diagnosis was rabies. In our homeopathic part, when the evaluation of the symptoms was seen, obstinate, headstrong, so obstinate, headstrong in children, and clinching, take the hand of mothers will always. Clinching child grabs the nurse when carried. Held, desire to be held, eliminating rubric. Light, desire for biting, biting himself, striking himself, shameful in children. And there was shrieking, and the shrieking obstinate. Timidity is seen, obstinate, headstrong, fever during, hydrophobia, injuries of the head after, extremities, coldness, teeth, caries, decayed, hollow, salivation, sleep, position on abdomen, head heat. The prescription after the repertorization, the first prescription striking all the symptoms was tremonium. 1 1 dose was given, and there was feeling of improvement. And later on the follow-up, belladonna 1 1 hourly was given. Again, feeling that the improvement is lagging, so no hydrophobia was seen. And later on, after the follow-up of the case, arsenic album 200 2 hours was given. Improvement continued in all respects except irritability and desire to remain in his mother's hands. And later on the aggressiveness was seen. So chamomilla 1 3 hourly was given. No further symptoms was seen. And lastly, SLTDS for 10 days was given, and the patient recovered. So after that, no medicine was recovered. After that, no medicine was recommended. So this is one case of rabies or the dog bite. So we see many homeopathic medicines after the dog bite, which will help So dog bites and its treatment with homeopathy, owing to their popularity as household pets, and dogs account for the majority of bites as a result of protecting their owners and territory. Means the animals bite when they feel like any human will hurt them or beat them. So in that or aggressiveness of the dogs, they bite humans. So it may be street dogs or the like in home if they have had like dogs and all, usually they only causes these dog bites. So dog bites typically have a ragged torn appearance, and the cat bites involve deep puncture wounds that frequently become infected bites are painful, swollen and red. So rabies may be transmitted from animals, most commonly bats, raccoons, foxes, and skunks infected with that organism. Rabies is rare among pets in the other United States because of vaccination, but in countries where animals are less likely to be vaccinated, bites from pet animals may transmit rabies. So, bite from the pet animals also transmits the rabies disease. So, vaccination of the dogs or the cats is very important, which is done by the veterinary department. So when dog bites occurs, what is the first is, as I have already told, there should be wound cleaning. Okay. After receiving a routine first aid treatment, people who have been bitten by an animal should see a doctor immediately if possible. The offending animal should be penned up by its owner. If the animal is loose, the person who has been bitten should not try to capture it. The police should be notified so that the proper authorities can observe the animal for signs of rabies. Because that if any street dog bites any humans, that dog has to be the concerned department has to catch that dog, because it may bite other human beings also, and it may causes rabies death. So doctors, so when any dog bite comes, doctors clean an animal bite by flooding the wound with sterile salt water, saline, and cleaning it with soap and water. Sometimes tissue is trimmed from the edges of the bite wound, particularly if the tissue is crushed or ragged. The homeopathic treatment or the remedies for this is, first one is aconite. In aconite, there may be great fear after an animal attack and bite. Aconite should be the first remedy to give to help with shock. So in aconite, there will be great fear and shock will be there. So the first remedy is aconite has to be given. In arnica, the other remedy, as with all wounds and injuries, arnica can help with bleeding, swelling, bruising, and general healing of all wounds. It is the leading remedy and most available. Arnica is available everywhere. If there is not something more specific about the wound, arnica nearly always helps. Other remedies, arsenic album, when the wound has burning pain and is becoming inflamed or infected. If arsenicum does not work in infection with burning pains, try anthracinum or pyrogenum. Arsenicum may also help with headache after a bite. The other remedy is belladonna. High fever after a bite, the wound becomes hot and red with swelling, good for dog bite and the treatment of rabies. Other remedies for dog bites means the other remedies, calendula. After laceration and torn tissues, it is also good in mother tincture or potency, or to irrigate open wounds in sterile water, or apply to the skin around wounds to promote healing. It is very antiseptic. Heparin sulf after the wound becomes infected with much pus and foul smell, especially good to promote suppuration in a closed puncture wound. Hypericum, especially good in all puncture wounds and wounds that are very painful. Bites to fingers, toes, nose, ears, bites along nerve pathways with much pain. Another remedy is lachesis, bites that are blue and painful, fainting after the bite. Ledampal, bites, especially puncture wound bites, bite become cold, blue, helpful to prevent rabies from developing, good for the bites of rats also. Lysine, the rabies nosode, a very good remedy in all bites, especially in dogs and cats. One of the first remedies to think of, if there is cat scratch fever, often responds well to lysine. Stramonium, the leading remedy in advanced rabies infection. Think of stramonium and belladonna. Uh, in one of the government school, recently I gave a health awareness program regarding rabies animal bites to the children, to the high school children, and health camp was also done there. So health education is very important because knowingly or unknowingly after any dog bite, if any patient doesn't go to any doctor or clinic and if they don't take any treatment and it causes death, so these rabies symptoms also, it is one of the zoonotic disease, and these rabies symptoms also, when the saliva is drooping from the mouth, it can spread from one person to another also. So this is very dangerous and very important topic. So September 28th is celebrated as World Rabies Day also. So it's very important as we, a homeopathic physician, we should give a proper um, awareness to the patient who come to our clinic and to our known people, and if we can go to any villages, schools and all, and give a free health education so that they know what is rabies, and like what if dog bite or any animal bite, because many people, educated or uneducated, in street dogs or in home, if they have any pets, if they bite, they don't go to any doctor. So we have to give a education to the society, to the people, so that if in any street animals or the homely, if they have any pets, after the bite, they have to go to doctor and take the treatment so that life is saved. So this is the topic which today I have discussed. Thank you so much. Sir? Sir?
Yes, I was here.
Yeah.
Yes, really a very good session indeed. And as you rightly pointed out, we need to look into the school education, not only for giving students, but also for pre-public also. But the awareness is one of the most important aspects as far as the rabies is concerned. Whatever be the disease, we will have to educate people in such a way so that they can understand what is what and how one can manage all those things, whether it is homeopathy or the modern system of medicine, whatever maybe the prima facie one should know. Anyway, your subject presentation was really excellent, and we are very happy to have such sessions. And thank you for such an excellent session here. Now I invite the participants to have a discussion, and those who want to participate in the discussion can raise your hand so that we will allow you to unmute yourself and you can talk. Yes, sir. Yes, there is no one raising hands, so we can go to some kind of discussion. I mean, I'm inviting Dr. Mariama John to say a few words on this. Dr. Mariama John. The case you presented here was also a beautiful case, and from the very case description itself, I got the idea that it's stramonium. Of course, one need to differentiate between stramonium and belladonna and HCMS. These are the three remedies working for all these conditions. That is the reason why we can even advise these three remedies in advance encephalitis cases also, because both are having affinity towards the brain, and all these diseases affect the brain. So those remedies that can be the symptoms shown in stramonium. Stramonium is the most probable remedy for that also, because the fright, they cannot even look at the light, and they always want, they cannot think of darkness. They always want light, but afraid of the same thing. That is also one. The clinging also is one of the prominent symptom, and these are the basic difference between belladonna and bryonia. But the violence with which it is struck is I usually find in belladonna, and not in the most violent remedy is of course belladonna. Am I right?
Yeah. Yes, sir.
Now, frankly speaking, actually, nowadays, when such a disease happens to somebody, happen to somebody, usually people rush to the other system of medicine. And how it came to you? That's the question. Because
Huh. Uh, Sir, actually, it is from other state. Uh, like they are laborers. Uh, Actually, that person is a laborer, and actually, he doesn't know, or his family members, they doesn't know, like after a dog bite, they have to take vaccination or go to A&E. And it was referred from other doctors also to me, like and unexpectedly he came, and other doctors also, like he was reluctant to take any other treatment also, so he came. So after taking the case history, and he was already diagnosed as rabies. So based on totality of symptoms and evaluation of symptoms, stramonium was given maybe 2 years back.
the patient was in your at your bedside when they came visited you. They brought the patient to your bedside or your clinic, or you just hear the symptoms.
Sir, actually, 2 years back, I was working in another in another setup. So I was working along with senior doctor. So there, the patient was referred from other doctors. So at that time, I had seen this case.
Okay, okay, that's good, because in some part of the country, people's a lot of I think it's somewhere in Karnataka also. One of our doctor was there. He was using he was treating homeopathy in a hospital made by some Christian missionaries, and they used to treat this snake bite as well as this rabies like symptoms,
Hmm.
diseases that comes on their way. That's why I ask such a question. But in Kerala, actually, if something happens like that, people rush to the modern system. So, there is no chance for us to treat. And when they are there, they isolate the patient, and all of a sudden the patient becomes was because of the fear, and we have seen that even after vaccination and medication, some patients died. Very recently, some such reporting was made in the papers that some people who were bitten by a stray dog died of rabies, even
Yeah,
even on the treatment on the modern side.
yeah. Yes, sir. Actually, recently I saw in online one girl, 8-year-old, in another state I have seen. Like after taking the Rabipure vaccination, also she had suffered from encephalitis, and she died within 1.5 month. So maybe there is a complete failure of vaccination or
Yes, yes, yes. In those conditions, we can use when the patient is in the hospital. Even at that time, we can give our medicine if the patient's bystander can do that, because
hmm,
that's how we can manage. If the patient is isolated, then definitely we can manage the case.
hmm,
If the bystander allows, that is the
hmm,
problem. Because the
hmm,
modern people, some of the doctors are prejudiced, though it is not worthwhile to give homeopathic medicine when the patient is in their hospital.
hmm,
They are
hmm,
ready, even if they are ready to sacrifice the person, they don't allow us to treat. That's the
hmm,
that's the biggest
hmm,
challenge in front of us. And frankly, they don't have no idea about it. They
hmm,
think that's the reason most why even in Nipah cases here in Kerala, already one child was detected as a Nipah patient and was died yesterday
hmm,
morning.
huh,
Well, they don't allow us to treat. That's the problem.
hmm, hmm,
Frankly, these were the medicine that will definitely work in this encephalitis. The Nipah also having the same will show the same signs and symptoms of
hmm,
encephalitis, and the death may occur in that
hmm,
way. So
hmm,
in those
hmm,
conditions, also the medicine used for this rabies is a very good medicine. So also the latest disease, it's in the viral
hmm.
disorder in Gujarat. It can also be managed with our homeopathic medicine. If have you heard of that disease?
Hmm.
That already killed some more than 10 children in Gujarat very recently.
Huh.
Have you heard about?
So sorry.
Have you heard about a disease that killed more than 10 children in Gujarat very recently?
Huh.
So in those conditions also,
Huh.
we can utilize our system.
Yeah.
Chandipura virus.
Yes, Chandipura virus. That's what we were looking at. Chandipura
Huh.
virus, which are really affecting the brain, and as a result of the uh, problems in they are resulting, they're showing the signs and symptoms of just like rabies.
Hmm.
And so, but the same medicine can be used in those conditions also. Thereby we can save the patients, and not only that, we can use these Belladonna Varnam and Stramonium or the Cupromet because there are
Hmm.
other symptoms like that, diarrhea, vomiting, all those and in sudden violent fever that may occur in those conditions. And in
Hmm.
those conditions, we can use this our medicines as preventive also.
Hmm.
I
Hmm.
invite Dr. Mariam John to add something more on that.
I have to ask a question. What about the hydrophobinum for rabies as a preventive or treatment?
Sorry, ma'am. Hydrophobia?
Hydrophobinum.
Yeah. Ha ha. Yeah.
Is it
Yeah.
as preventive also for treatment?
Yeah. Hydrophobinum. Yeah. For treatment part also it can be given and as a preventive part also. But in the extreme, in the late stage of rabies, when the because I have seen in the online the cases how the patient is in the late stage of rabies means hydrophobia means the patient doesn't like the sight or of the water. Even though the patient is very thirsty, they're not able to drink the water. So in that extreme stage, means it will help in homeopathic hydrophobia. Will maybe it may help, but it's better to in the earliest, like when any dog bite occurs, they have to go to doctor and take the vaccination or the treatment. That is the best solution for this.
Thank you, Doctor.
That's also a very good question and very good answer. And we have our medicine hydrophobinum also for that. That really works. So
I want to say, is it work as a preventive instead of vaccination?
yes, that can be utilized. Definitely, we can think in that line also. Am I right, Dr. Shalini?
Yeah, it can, it will act, sir. It may act as a preventive medicine. It can be considered hydrophobia.
Yes. What is the present situation in Bangalore after the climatic change? Whether the monsoon has produced so many influenza cases or so many diarrhea, or what is the present situation? Because we have
Sir, actually in Bangalore, it's presently it's raining, sir. It's very cold here,
yes, that
and sir, here more of like mosquito bite, dengue cases are raised here.
yes,
Fever
definitely.
cases fever cases are more in
Uh,
OPDs, IPDs.
Same is happening in Kerala also. We have almost all viral diseases are here. Uh,
Mm,
Along with that, the dengue fever is also there. But dengue cases we can easily manage. There is nothing to worry about dengue
mm,
fever, because I have a person who has affected some dengue some 5 years back, I think, and
mm.
it was fully managed with the homeopathic medicine there, and there was no admission, even though the platelet count went up to 50,000, and
Mm-hmm.
we stick on with the homeopathic medicine, and the Baptisia 30, Baptisia 200 really bring back it to 1 lakh within 1 lakh 22, then the very next day, and then day after, 2 days later, it become 3 lakh. So that's the
Okay.
beauty. That's the beauty of homeopathy, because the signs, the symptom was exactly when I was trying to sleep on my bed. I found that it is very difficult. I was feeling pain whenever I
Mm,
took telling about the part touch on the blood was really
okay.
painful, and I
Mm,
couldn't sleep. So in that condition, there was a little bit confusion in mind that
mm,
whether I should think of arnica, or whether I should go with the Baptiste. But suddenly I called my friend, and he's a senior doctor, and who was guiding me in those conditions. And then
mm,
he told me that you may go better to go with the Baptiste 200, and then I just took that, and it
mm,
really bring back. That's the beauty of it. Even no platelets transfusion or anything.
mm,
No admission, no nothing. I just practice even in that days with online, because I was
mm,
at home for 5 days, and all the first 3 days I just completed my treatment all through phone, and then on the fifth day, the problem arises, and then I,
mm,
I I got the advice from my doctor. Only on that particular day only, I
mm.
didn't get the,
Uh-huh. Okay.
but I didn't practice. So that's the
Mhm,
beauty of homeopathy. You can do all things whenever you are in the fever, or whatever may be your condition.
mhm.
Uh,
Yeah.
Nobody could believe that such wonders can happen with homeopathy, because your belief is one thing that's required, that you should stick on your system naturally
Yeah.
out here.
Mm,
In rabies
mm,
also, that's the reason why when you give the stramonium, that works on that. Which potency you give? It's 1 or 30?
Sir, in my case, stramonium 1M was given, sir.
Okay, and that's when it is affect. Definitely, that's the good thing that you can give one of potencies or some other potencies. Always high potency are the best.
Yes, sir.
Yes, that I would like to add to you. Add to the session. Anyway, congratulations for treating, you showing such courage to treat rabies case with homeopathic medicine. I invite Dr. Rambaresh to speak for the time being. Yes, sir, you can. Dr. Manoj, please make me a co-host, and hello, Dr. Rambaresh, sir. You're the host now.
Thank you, Dr. Ganeshji and Manojji. Congratulations, Dr. Shalini Madam. Very nice presentation.
Thank you, sir.
Dog bites. Describe the excellent session. Describe the beautiful describe. Dog bites, sign and symptom. Very kinds of medicine. Prevention. It is not prevention. During treatment, bite after bite treatment, hydrolysin and hydrophobinum, belladonna, astomonium, lachesis. So hydrophobia and fear of water and light, cannot bear the sight of bright objects. So, astomonium locality of symptom, and lachesis subject to another subject, sign and symptom, a kind of mania. Mania after bite. The hydrophobinum is a very good remedy. 200 potency, 1 dose, and high fever and symptom, belladonna is a good remedy. Belladonna, burning, red, inflammation, and delirium. There are 4 symptoms. Belladonna is very good remedy. Very, very thanks, Shalini, Madam. Very
Thanks.
nice for the excellent session. Thank you. Thank you.
Thank you, Dr. Rambaresh, sir, for your excellent addition to this session. Dr. Manoj, what's your opinion on this rabies treatment? And
Definitely, it was in fact mentioned by Dr. Samuel Hahnemann first. You can see in the lesser writings, essay on this rabbit treatment, the rabbit dog, and he mentioned just not hydrophobia, but it is aerophobia, and mentions cannabis is one of the wonderful medicine. Recently, the medical science accepted that more than hydrophobia is aerophobia. So that much excellence is there. Then we all know that our Dr. James Paul, one of the retired chief medical officer, he is a member of this IFPH. He was bitten by a mad dog, and he took hydrophobin 10 I think Dr. Dharesh may be remembering that twice, and nothing happened. He rescued. He's still there. They were around 45 years back. At the same time, what happens? The vaccines are not safe, that much safe, because they claims if 100 persons are bitten by this mad dog, 95 persons will not be affected with rabies. At the same time, the vaccine is also effective 95%. What is the meaning? If the logic, you can see that it is often doubtful. But with some rare influences, these things are accepted. But what you have done is a tremendous job. There is no doubt about your potential. Such young, talented persons are really doing good job. Congratulations, Dr. Shalini.
Thank you, sir. Thank you, sir.
beautiful answering. Dr. Manoj really added something more on that, because that is also an experience. I just forgot about the same that was mentioned by our Dr. Uh,
Is for
yes, sir. Yes, sir. Some years back in the presentation, he really he was really saved by this hydrophobia. So these are the things that we will have to remember always, because that will make us, as if somebody have such a bad thing, definitely one need to take these medicines.
yes.
That will protect you.
Those who are in this care in this
And
hospital,
even if you take vaccination, you just continue with homeopathic treatment,
definitely.
because of the compulsion from your family, or sometimes the compulsion from the other professionals, that you may have to rush into the hospital. But of course, you may be taken to the hospital by somebody else, and they may give you this medicine, this injection. But in the meantime, you can call for your hydrophobia for that, and that will definitely work. What's your opinion on that, Dr. Shalini?
So as I have already told, like we need to take the case completely, like individual homeopathic remedy we have to select. So means any case which we get referred from others, or any case, we need to take the case completely, and individual characteristic symptoms we need to take from the case, and based on that, when we give the constitutional remedy, definitely we get a good results. So in emergency cases also, and in acute, or in if any long standing diseases also, homeopathy will help. So the
Definitely,
proper,
this is mentioned by Hahnemann as fixed miasms, because their manifestations are common. There is no difference in the last 100 years. That is why Dr. Ganesh said you can use such and such medicines. That's the difference. Okay.
yeah, yes.
Anyway, congratulations for your excellent presentation. And it is the time for auto thanks. I invite Dr. Mariamma John to say thanks to this session.
Congratulations, Dr. Shalini. It was a nice presentation and excellent section. On behalf of IFPH, I thank you. Thank you, Doctor. Come again with another subject.
Okay, okay, thank you. Thank you.
Tomorrow, we will have a session from Dr. K. Srinivasan, MD Homeopathy, and he will be presenting a paper, nerve injury. That means all about injuries and its management with homeopathy. That's what tomorrow's session. And thank you, Dr. Shalini, Dr. Those who participate in the session. And with that, we come to the end of the day, 1421. And today, it is the time to wind up the session. Thank you all. Good night. All to